Fantastic. Hello from all over the country. I see y'all checking in over there on the right side. That's awesome. Good afternoon. Appreciate everyone attending today. Our Purell Pajamas, BD in a COVID world conversation. Today's going to be a real panel series. So over to the right, you'll see the opportunity to ask questions that we might not capture today during the session. Appreciate everyone sending their requests over early, and please keep them coming in. This will be actually the first of many here for Lakeview, so keep an eye out on LinkedIn and in your email for upcoming ones from our medical team and other departments. But for today, I'm going to turn it over to Jordan Young with Jordan and Associates to be our moderator and hopefully answer all the questions that y'all had for us today.
Thank you, Steve. So good afternoon, everyone. Thank you for joining us for Purell and Pajamas, Business Development in a COVID-19 World. Hope everyone is staying healthy, safe, and sane during these times when our lives, as we know them, have been drastically altered. Like Steve said, my name is Jordan Young. I'm the CEO of Jordan and Associates Consulting, and I will be your moderator. So I want to say thank you once again to Lakeview for the idea and the organization of the panel. For those of you that don't know Lakeview, they're a great program. They have an outstanding staff, and I encourage you guys to get to know them. So I'd like to introduce our all-star panel of three of behavioral healthcare's finest in business development. First, Jamie Vance, the CEO of the Vance Group. Jamie has over 15 years experience in behavioral healthcare business development. He's held senior business development, vice president of business development, and CMO positions for our industry's most well-known program. Jamie's leadership and success in building and managing business development teams has led him to create the Vance Group, which helps treatment centers plan, execute, and maintain a business development strategy that takes them from infancy or a middle-of-the-pack mindset to being leaders in our field. Next up, Doug Penny. Doug Penny is a partner and the Director of Business Development at Southern California Recovery Center. They are one of the largest and most successful IOP and sober livings for men in our country. Doug's business development approach to relationship building has been instrumental in SCRC's success. They currently have locations in Carlsbad, Dana Point, Encinitas, and Palm Desert that provide safe and supportive environments for men to recover from their seemingly hopeless condition of alcoholism, addiction, and co-occurring disorders. And last but certainly not least, Steve Denai. Steve is the Vice President of Business Development and Client Services at Lakeview Health in Jacksonville, Florida. Lakeview is one of the industry's premier facilities for treating individuals battling addiction, chronic pain, and co-occurring disorders. Steve has almost 20 years experience in sales and over 6 years in behavioral health care. He's enjoyed success as a business development representative, business development manager, and as a vice president. Everyone, your panelists for today. So a few housekeeping items. We have a list of questions that we received in advance. I'll be reading these questions and either opening them up to the whole panel or directing them to specific panelists. Panelists, once a question has been answered, feel free to jump in and add your feedback, but don't feel like you're required to answer every question. So for those of you attending, I think you might have heard Steve, or if you didn't hop on here in time, there is a chat box. You can type in your questions and we'll try to get to some of these during or at the end of the presentation.
I think they found it.
I think they found it. Yeah, it looks like it. I see a lot of hellos. So with that said, let's kick it off. So this first question comes from Kimberly N. So she asks, how's everyone doing with admission? How can we ensure that a client coming to us didn't pick up the virus at a gas station or on the way to us? They may have been self-quarantining at home to ensure they don't have it before they came to us, but there are just too many unknowns. So the main question is, what measures are others taking to ensure the safety of their current milieu and staff? So I'll open that up to any of you guys.
Steve, you want to take this one?
Thanks, Jordan. Yeah, I mean, what I'm seeing across the board is that, this is not, it's not a business development decision there, and that's where it's the multidisciplinary approach to, really defining what your safety protocols are going to be. The first part of that question, how is everybody doing with admissions? I get a unique view into, multiple organizations. And the one unique thing that I'm seeing is that theoretically on a whole, there are people doing very well with admissions, I guess, if that's the way you would put it, that they're getting a lot of people admitting to treatment right now. I think the differentiating factor in that is the adaptation of the organization, which we'll get into that a lot more as we go along today. But, what are organizations doing to pivot right now, I think, is the question behind that. And as far as the folks that I'm working with, what we're doing is we're allowing that medical expertise to have the voice in what should we do right now. And that varies from facility to facility based on, the concentration of the virus in the area, the likelihood of travel to treatment. There's a lot of factors in that. But, and also seeking outside opinion on medically what are best practices during this time. And that is not my expertise, so I don't weigh in on that, but that's what I'm seeing.
Yeah, and if I'd add to that, I think how's everyone doing? Some of our partners have indicated that nationwide call volume is actually up, but empirically conversion is probably a little lower these days than typically due to that fear. Sitting at home, isolation, being around family, all these things that I think we know to be true during this time are starting to get people to have the phone ring, but not necessarily always equating to admissions. And I think the question to how can you protect yourself, or how do you know if someone doesn't pick it up, like you said, at a gas station? There's a couple ways of approaching that. I think the first is, like Jamie mentioned, it's multidisciplinary. So getting with your medical team, getting with your leadership, and realizing what level of risk your facility has the ability to take, and being very real with yourself. I think this is a time where, as business development reps, we need to have a very real understanding of what our capabilities are at our facilities versus what the patients are actually presenting with. On that note, too, I think the answer also is we don't really know if they pick it up or not. Someone can self-quarantine for 2 weeks and go to the grocery store on the way and get a pack of cigarettes. So being careful of certain regions is definitely one way of doing it. If you have a facility that's able to test, that's a great way to do it as well. But then knowing your limitations and bringing patients in and communicating that with your referral sources, I think is really paramount.
Yeah, for me, it's just been, heavily communicating with our referral sources from the residential level. Obviously, as a step-down treatment center, we're not as vulnerable as people on the front end are, like you, Steve. We're getting people who are still actively in their addiction. Usually by the time they get to me, they've already had 30 days of quarantine inside a residential treatment center. So from the aftercare standpoint, it's really just, making sure our admissions process, checking in with the discharge planners, making sure that they don't have a temperature, they're not showing any symptoms. And, we're just essentially we're doing the best we can with the information that's given to us, because, right now we're dealing with a demographic that is also dealing with what we're dealing with whenever we have to go to the grocery store, whenever we have to go to the gas station. So when you talk about not picking it up, all we can do is really make sure we've checked all the boxes and, have procedures in place so that if someone does come in with COVID-19, we're able to quarantine them, we're able to contain our houses, and we're able to, still provide quality care and not just only treat COVID-19, because we're here to treat addiction still. So I guess in answering that from an aftercare level, it's just having the safety measures in place for if that does happen, or, essentially when it does happen, we're set up for it. So that's kind of our take on it.
Nice. Thanks, guys. So next up, what advice do you have for reps to stay top of mind for existing referral sources in the virtual world? In addition to that, what practices are your teams employing to generate interest from new referral sources when they can't go see them in person?
So what we've been doing is, first and foremost, we're dealing with something that we've never encountered. So we want to go and kind of dig into we're trying to go to the well again and try to get referral sources out of ways we've already done it. And what I'm encouraging my guys to do is not call and have the conversations about, well, we could really use some love right now, or we could really appreciate this. Instead of doing that, I'm telling people, have a conversation, ask people how they're doing. Like, if you want to stay on the top of someone's mind, actually really care about the interest of everyone around them and make sure that the people we've been working with for the last 5-10 years are doing okay. Like, how's their families doing? How's the business running? Not just economically, but what's the mood like there? Has hysteria setted? Are people scared? Are people afraid? And how do you alleviate them of that? If you want to be a good rep in this field, it's not just, numbers and everything else. And if you want to build your book of business, build solid relationships with people. We're in a position where we can truly build solid relationships with people, because right now we're all in a foxhole. The whole world is in a foxhole together. Like, we've never had an opportunity to build such solid relationships with people and do it in a very genuine way. So that's what I'm encouraging my reps to do, is build genuine relationships, and maybe not go for the wider net approach, but really hunker down and really make sure that the core that's always been there is really okay, and that they're okay personally and professionally. So that's kind of been my narrative to my reps.
Absolutely. I think I'd add to that. During this time, value is probably more important than ever before. If you're not bringing value to a conversation, you probably are going to get brushed off. I look at my LinkedIn messaging inbox, and like many people on this call, it's full of people not adding value. They're clearly trying to sell for the sake of their own business. And I don't think any of us have any interest in that these days. We're all really worried about our own employees, our staff, keeping our nurses there, keeping our techs moving forward, keeping everyone safe, and keeping everyone in a good place. And if you're not bringing that message to the calls, to the emails, to whatever you're doing, it's not going to resonate. It's going to come off as being about me versus being about you. If you're on the PLA, I actually wrote an email about that recently. Probably the most cardinal sin that we're getting right now is people texting me saying, I have open beds, or, we have open beds, and no kidding. We all do. It's there's a virus out there that has us all sitting in our homes watching Tiger King. It's going to be an issue, right? So bring value and be real, like Doug said. And then as far as like behaviors, it's time to get old school. I think it's really one of those times to get really comfortable with the phone, get really comfortable with writing letters. I think we have a follow-up question about that here in a moment. Think about technologies like selling in the 80s. And I know a lot of people probably on this call don't have a lot of experience with like really old sales tactics and things like that, but the guys back then, they made it work on the phone. They made it work distance-wise really well. So consider some things like that. And if you're not good at them, by May you probably will be.
Yeah, I would definitely, echo and agree with everything that's been said. What I can tell you is that, some of the most profitable companies in the world right now, and some of the biggest titans that we've ever known about in business, were born out of devastating times. Some of the companies that, the cards you've got in your wallet right now, a lot of companies, a lot of big companies and titans of business were born out of the Great Depression and other bad, seemingly really bad times. And what I'm advising folks to do right now is that this is what we would call a defining moment. And you're either going to be defined by the guy who sends the text and says, hey, I got an open bed, because all you're thinking about is you, or you're going to be defined as the person that rises above and says, what can I do right now? How can I make this in some little tiny way? What can I do to make this better? And one of my people that I work with, she's actually on the call right now. She started a book club in her area, for clinicians and therapists who are at home. I've seen people, do free support groups in their local communities. I've seen people, host AA speaker jams or, recovery speaker jams in their area. I've seen a lot of cool stuff, and you're going to see two different things right now. You're going to see the cream rise to the top and the silt, float to the bottom, and that's what this is. This is a defining moment. And so, I think another thing that I've really observed, because I work with a lot of different teams, and what I've talked about lately is there's a type of person that walks up and hits a wall. And there's a person, and, I know everybody on my side of this call right now is this way because I've worked with them. There's a type of person that's going to chew through the wall, beat it down, jump over it, do whatever they got to do. And then there's a person that's going to sit there until somebody gives them the answer. And I got news. Nobody's going to walk up to you and give you the answer right now. You're going to have to figure it out. So it's going to be a lot of hustle, and you got to measure what you do and see what works and see what doesn't. But for example, one of the things I've seen that's innovative is that hospitals right now, some hospitals in some areas aren't taking in new patients for detox. So instead of going and bringing brownies to the case managers like people usually do for the 1,000th time, somebody got innovative, and they called and did a Zoom call with the nurse that lets the people in the emergency room. I'm blanking on the name right now. The triage nurse. And they said, hey, we know that you're getting all of these. And so it's be the solution. That's how you be successful, is you are the solution, whatever that is. So good stuff.
Excellent stuff, guys. So Steve, this is kind of a follow-up question to what you alluded to. This was a question that Michael V sent in, and he asked, is it encouraged or discouraged to send handwritten mail as a form of contact during this time?
I saw that one last night, and I didn't even think about that. I got to say, that was the first I thought about it. So the words that are about to come out of my mouth are, in my opinion, not necessarily that of Lakeview, and they're probably going to be disagree with some people on this call. But while COVID can be spread on letters and it can be spread on envelopes, I don't think we've seen a single person contract COVID from a letter that just randomly popped in their doorway. And even if that is the case, the recipient letter has the opportunity to decline picking it up or decline opening it or doing it with gloves or doing it with Lysol. So I just think it's kind of a stretch to be afraid of that at this time. That might just be me, but I would keep doing letters. If you have addresses, I'd say keep doing them. Again, always add value. And then, if the other person doesn't feel comfortable with it, by all means, then they shouldn't open it up or get their mail. But I think people are still generally getting their mail these days. But that was an awesome question.
Yeah, I mean, I agree with that. I think that anything you can do to develop a better personal connection with people and really just check in with people on that, intimate of a look is something that I'm all for. I mean, people want connection right now, even like hug people right now. So any type of connection you can make on a person, I think is just good. I think it's just good for even outside of business, just connecting with people on that level. Just that someone knows you sat down and hand wrote a letter to them is just going to mean more to them than, a talk to text message. So yeah, I definitely think that's a good thing.
Okay.
Got a good comment in the Q&As. Thanks, Katie. Katie has said she's told people let the card sit for 24 hours before opening it. That's another good way of doing it. You send someone a letter, give them a shout, I sent something to you. You might want to let it sit. Good idea.
Yeah, good comment. Okay, so here's a question from Cody. Cody asks, how is the cash flow and fringe cost to treatment being affected by the pandemic? Are families still able to come out of pocket with deductibles and copays?
I personally haven't seen any changes. I think if I could just empirically guess what's going on is families are seeing their loved ones up close and personal more than they ever have. Either the 5 o'clock drinker is now starting at 4, then 3, then noon, and then all day, or the son who had to come home from college early is leaving the house every day to go get their fix, and they're wondering why they're quarantined, but their young one's leaving. And I feel like there's a lot more family members compelled to come up with the differences in copays or deductibles or whatnot. So I think if anything, the people who are calling in for treatment are very serious about it and have a little more support just because they're stuck around their families. As far as the legislation is concerned, I haven't seen anything yet in the legislation that would indicate that copays or deductibles are waived for our treatment like they're waived for the COVID tests. I don't know if that answers the question.
Yeah, on our end, we're seeing that, the people who are still wanting treatment right now are, they're willing to come up with it because everyone is in so much fear right now. I mean, and I've said this before on another talk I did, that we're in an unprecedented time, that there literally almost no barriers to entry for the first time since I've been doing this. I mean, no one can say the is holding me up, the girlfriend is holding me up, because most of the time, like, I'm just going to follow up what Steve said, is all your alcoholism, all the addiction is coming to the forefront when you're at home all the time. You can only sneak around so much, before you're getting caught. And I think that families are more willing to put up the money for the copay and do all the necessary things to get their loved one help while there's a block of time to do that. Like we sent out a guy who worked in the restaurant industry, and he said, this is the first time since I've been in this field, or, that I've had an opportunity to actually take a month away from my job and actually get my head right. And I thought that was an interesting thought, is that people are so busy, people have been so consumed with life and doing everything, that this is a rare opportunity to really start getting some people help that they need, that they've put off because of other obligations they've had.
And that is an interesting topic too, because in most cases under this new law, furloughed employees, not laid off perhaps, but furloughed, still being covered under insurance, but they're not working. So you actually have a large amount of people who can have their coverage for treatment and finally have the time to do it.
Yeah, and I'm seeing that on a grand scale right now. I'm seeing that, and I've told people, like, call your hairstylist, call your personal trainer, call people in the community that you're connected with, and just ask how they're doing, because they might surprise you on the referrals they have for you. It might shock you. People are, if they're going to be locked down anyways, I think most people who've been to treatment know they have a problem long before they ever step foot in a treatment center's door. So they've been dealing with this, hiding it, and really battling with it, and now they have a time to go. So I think that, just reaching out and getting involved in your community, you're going to be able to find a lot of the people who, need treatment. And going back to what the original question was, as far as cash flow and deductibles, I think that most people are willing to cover that right now, from what I've seen. That's all I got on.
All right, thanks, guys. So moving along. So this one relates to the current virtual landscape of business development and its current state, and if and when we're able to get back to operating as before. So can you guys discuss some strategies or value propositions that you guys have been successful with meeting with different types of referral sources? So employee assistance programs, interventionists, other treatment centers, therapists, or the actual end users of our services, patients and their families. So if you guys want to maybe take one or two each.
I can tell you kind of some meetings I've had. I actually did an in-service with all the discharge planners and therapists where they were all on one of these platforms. It was Google or Zoom. But they all there, and I did an in-service where I talked about my program, told them what measures we're taking, and was able to break down my program. And it was almost like I was there. And I've been able to actually expand my business by doing that. And that's saving me the trouble of having to travel, go there, meet with a team and all of that. Obviously, I lose the personal connection, which I think is huge, but we've been able to navigate that pretty well. And we're still able to do in-services, like I said, and still able to, kind of expand the business by doing that.
And Doug, to that question, how difficult was it to get that meeting? Did you do anything particularly different than you've done in the past?
Not really. Like Jamie said, like I'm gonna kick in a wall. You know what I mean? Like I'm gonna bug people and be like, hey, like I want to see how everyone's doing. Until I get that meeting, and whenever I do, I'm gonna do my best to present my program in a positive light. And I think that I think that people are feeling a bit defeated by all of this virtual stuff because you can't really, get the same effect that you do when you're in the room with someone. But I feel like in some ways we're able to connect with people across the country that we normally wouldn't ask that. I would never, 6 months ago, I would never ask a team of discharge planners, hey, can we all hop on a virtual call? I mean, I would have got on a plane, shown up, and did all of that. So, I feel like it went really well, and I felt like it's something that I would probably look at doing even after this passes. If nothing else, is just a warm-up meeting to the actual Washington meeting.
Yeah. And to add to that, I think that you look at it two ways. First way, if you have existing relationships, these sorts of things are going to be a lot easier, obviously. Picking up the phone, give them a call. I think yesterday I was on a call with a benefits administrator in Atlanta, a broker in Jacksonville, and a dispatcher in Cincinnati with reps from Fort Lauderdale and Alabama. And I couldn't have done that otherwise. Like that's not a one-day trip. 3 weeks ago, that was a whole week for me. So I think it's actually beneficial, and people are really warming up to this. I mean, technology has been around for a while, but I think people are a little over the newness of it and just kind of roll right into it. I mean, we see there's 140 people on here now, and it's easy to get into. You're on your phone, you're on your laptop, everyone's at home. I think the second group is that the people you don't have those relationships with, that you're trying to gain relationships with, and I think a good example might be like a doctor or something like that. I think the conversation is a little different than it used to be. It's very real. Hey, it's a little weird times. Obviously, I can't do an in-service now, but how's late May? How's June? How's July? Eventually we're going to blink our eyes, and it's going to be later in the year, so you might as well prepare for it.
Right. I one of the, what I'm seeing both in my own personal business and in me, developing business and in, consulting, other companies on doing that is it's where I think it's forcing, it's going to force you to either develop the skill set that you should have, or further hone those skills that you already do have. But, what you should be, most of us should be doing anyways, is that if I want to have a meeting with Doug, I need to take time and prepare to understand what would be helpful for him. And I need to strategize on how I can be helpful to him. I need to understand his business and how I'm useful. And so, therefore, taking that time and presenting Doug with something that works for him, Doug's going to say, yeah, if I've done my homework. And then during the meeting, if I ask the right questions and come to the right spot, I'm going to be able to be helpful to Doug. But if I show up on a call with Doug and I say, hey, my name's Jamie and I work at Shiny Puppy Dogs Treatment Center, and we do dual diagnosis. We take PPOs and what I call, forgive me, but vomiting my brochure on people, if that's my limited skill set, well, yeah, people don't want to have meetings with me. But if I say, try to be thoughtful about what would be most helpful to Doug and his position and what he does, then he would. And so with some accounts that I work with, we've done, with one account the other day, we did 6 virtual tours with interventionists, because these interventionists are getting a lot of calls right now and they can't travel to these places, but they still need to help the families, and there's ways they can help the families. So we're trying to figure out how, I think if you always leverage what you have that somebody else might not have access to, or some way that you can help somebody, I think you're gonna do well. So I saw on the thread a minute ago, it said something about therapists don't have time. Well, therapists don't have time for things that aren't important, and neither do I. So do you have something that's important? And if you do, learn how to communicate that so that somebody can know it. And if you don't, then don't waste somebody's time, if that makes sense. And so I think taking that time to plan your meetings and plan who you're going to call. EAPs right now, what are they going through? Well, a lot of their workers probably can't show up to work because they're non-essential. What problems does that arise from? Do you know the increased rate of domestic spouse abuse in auto workers in the United States? If you don't, then you should. Do you know what their covered lives, what they're going through in regards to alcoholism, what that could look like? What are some solutions you can offer them right now that are going to help them? Hey, I know that a lot of your folks probably can't travel to treatment right now, but here's a solution we have for you. We've already got it set up. We've thought about what your employees need right now. Here's what we have. So I think it's that thoughtfulness and planning are going to kind of win right now, but it's not going to be fish in the barrel to where you can just kind of show up and people are going to, just want to talk to you. People don't have that time right now.
Hey, and so one housekeeping item for the audience, please type your questions in the Q&A section, not in the chat, because there's a lot of interaction going on there. Kind of difficult to keep up with. But here's a question from Thomas Byers. So Thomas says, it seems reasonable to believe this pandemic will impact society and the way we interact with one another for an undetermined amount of time. Have you all speculated on how this could affect the role of reps in this space? Example, would fewer reps be able to cover more territory electronically?
I like this question. I have 2 answers to it. I know Doug and Jamie will probably have more, but yes, I think it'll impact the way we interact with each other in this space, and I think that's a good thing. When I came into this space in 2014, I think James said fish in a barrel a little bit ago, and that's what it felt like, right? It was very simple. The web was up and call volumes were through the roof, and I think outreach reps got a way of trying to find people who really need help. I mean, what's the statistic? 23 million Americans meet medical necessity for substance use treatment, and only 3 million a year get help. And we kind of got away from finding those 20 million. This little period of time is going to hopefully energize our entire outreach community to step up and find those 20 million Americans, because those certain behaviors that we're doing now, the touches, the value adds, really reflecting on our ability to be outreach professionals. I think it's overall a positive, and we're going to come out a stronger industry after this if we do it right. Regarding the BDs in different markets, I still strongly believe to be a good community partner, you actually have to be in that community. So for the most part, I think you still need to have people in their markets getting to know, the real specific needs of that area. But perhaps ancillary markets, like I don't think anyone on this call has a rep in northern North Dakota. You could do that a little bit better now you have the skill set through a Zoom or Blue Jeans or something like that.
Yeah, I agree. I think that if reps need to be in that territory, whether it's for dinners, whether it's for knowing the landscape, whether it's just for visibility, if nothing else. I mean, if you're out of sight, you're out of mind in a territory, and you're not showing up at all the WAP meetings, the MOP meetings, and you're not showing up to all of the the gatherings, as this starts to go away and we start to, spend time around each other again. If you're not at the conferences and you're not visible and you don't have a territory rep in that, I think you're going to lose market exposure, and you're going to lose kind of your stature in that area. And I think that, like Steve said, we're going to be able to go after these more remote regions as people are a little bit more comfortable with using this type of technology. But I think for your major markets, you want to have someone there. You want to have someone that's physically visible, because so much of being a rep is you are always kind of under a microscope, and people are always watching you, because your actions and how you treat people are a reflection of the treatment center that you represent. I don't know how many times I've seen that, where maybe it's a rep at a certain treatment center. I don't know anything about that treatment center, but I definitely know how their rep acts. And so, I believe that treatment center acts accordingly to that. So I always think that having local reps who are really sticking with the values that you believe in your treatment center is always going to be a peril in this space.
Great. So going in line with that question, so we're seeing a lot of facilities that are having to close their doors. And with that, we're seeing a lot of business development reps that are losing their jobs. What advice do you have for those that are seeking out their next position, and what tips do you have for them to help them in acquiring that next job in business development?
Well, I think they should probably call you, but outside of that, I think that the big thing when you're looking at a new job in this field is always look at the reputation and look at what that place is going to bring to you as far as your brand, because ultimately in this field you have a brand. People know who Jordan Young is. People know who Steve Denai is. People know who Jamie Vance is, and we all have brands to us. We've been pretty consistent over the years. And people know that if I'm representing a place, then it's got a good reputation behind it, and I think that people are going to get desperate and want to work for places that maybe a year ago they wouldn't have considered. And I think first and foremost, you always got to think, is this a place I would send my kid to? Is this a place I would send a loved one to? And then you start there, and then you start looking at, is this a place that I kind of want to hitch my wagon to? Because I always believe that if you're a rep, wherever you've worked kind of stays with you, because you've gone around the country and told people that this is the best place on earth and nothing is better than this, and you should send all your clients here. So I think that in these times, you still have to go back to the basics and think, is this a place I want to be associated with? Do I believe in their corporate structure? Do I believe in the way they treat clients? And would I send a family member there? And that's always been something that, I think is the most important part about being a rep, is making sure that you're representing a place that you fully believe in.
Yeah, I don't think I can add really much to that. I mean, find out who you are and who you want to partner with and who you believe in. Call Jordan, but if not, call them directly and find who the person there is and be very persistent. I was thinking about my early days in interviewing and hiring, and when I went to these interviews, I knew everything about the person. I knew everything about their company. I was ready to rock and roll, and I really wanted to be their representative. And if you don't get that feeling on the interviews when we come out of this COVID stuff, it's probably not the right place for you. So, you make sure you're very passionate about what you do, and odds are you'll probably stay there for a long time. And that's the only real advice I have. We're going to regrow again. This is a short-term thing.
Yep.
Nice. All right, so Steve, Lakeview invests in probably the most comprehensive training program I'm aware of. Can you talk about the importance of new hire training, and what are some of the traits that you guys try to ingrain in candidates, and how do you go about doing that?
Yeah, and I'm probably going to grab one of these other side questions too. I think we have one, but the training, just real quickly about Lakeview training, and a lot of y'all on this call know I came from Foundations, where we had a really big training program as well. I think the cardinal sin in our line of work is that we hire people, give them a cell phone, a laptop, and business card, and say, go have fun. without having any ability to really understand their program, really understand in a deep level, blocking and tackling sales fundamentals, of call metrics, of all these things. And the reason Lakeview did that, and is one of the first things that we did when I got here, was expand upon a good program that Lakeview already had, and really make it just even more robust, so that by the time my new hires are out of their onboarding period, I would hope they feel very capable of being able to tackle any question that they might have moving forward. So, yeah, that's a good question. And I think that on the topic of what we're going on today with COVID, if you are one of the laid off reps I've seen in the chats, or even if you're trying to find ways of being valuable, this is a great time to build on yourself. So reach out if you need books to read, or if you need options or ideas for training sessions over the next month. Hopefully only a month. You can get a lot done. And also, just a little nugget for everyone: if you're an outside field rep, I did the math one time, and you probably spend about 24 to 36 hours 36 days in your car a year. So you actually spend about a month of time in your car. If you use just a little bit of that, half of it, to learn something while you're driving, think about all you'll learn over the course of a year, 2 years, 5 years. So those little bits of time, instead of listening to Justin Bieber's newest, you can really get some good information in there. So that's my little tidbit on that one. One of the questions here too, I'm going to jump ahead, Jordan, I hope you don't mind, I'm going to field, is asking about how not to come off desperate during these times. I think the answer is never come off desperate. We're providing a solution to save people's lives. If you don't have a solution during this time, I think, like Doug first said earlier on, make sure you're building relationships. You can take the time from home to build relationships, and you can worry about the admissions later. If your program might not be the best fit due to whatever reason, that's a good reason to build good relationships right now. But end of the day, alcoholism and addictions can kill way more people than this virus will. We're at 70, 80,000 people a year. So what we do is still frontline work, and you should not necessarily be desperate about it. You should be very proud of the work we do and how you can solve other people's problems.
I agree with that. I think that, to be a salesman is also to be a servant, so you're of service to the person you're talking to. And I think that the question is don't come off desperate, but it's also don't come off needy, and don't come off like you're only there for the referrals. And I think that that's something we kind of addressed in the front end, but I think that's everything, because a lot of conversations I'm having are reps being frustrated that they're getting calls about, can't believe this person asked me about referrals. I can't believe this during all of this. Like, I'm home with my kid. I'm stressed out, and I'm worried about, my livelihood, and they're asking me about referrals right now. So I don't think the answer is to ask for referrals. I think the answer to that is to fill gaps that people need, because there are gaps everywhere. And if you're in sales, the actual root of that word is, to be of service. So if you're in sales, you're of service to people. So be of service to them and fill the gaps that they need. Hey, Jay.
Hey, I got
we
one
were
off.
Yeah, we had some technical difficulties there. So we have, here's a good question from Ginger. Ginger says, I'll be transparent here. We're seeing families scared to invest in extended care when they do not know where the continuum of money is coming from. The willingness may be there, but the families are scared to invest their savings as they're watching the stock market crash. What do you guys say to your reps or your admissions staff when they're trying to overcome those types of objections?
I don't know that you want to overcome the word, that objection. I don't know. You kind of have to, there's a point of this to where you really have to be human and join somebody. And yeah, I bet that's really scary. So, and you also have your loved one has a, disease of addiction, which is chronic and fatal also. So how can I support you right now? What can I do? I don't know that I would try to convince somebody one way or another, but just really understand that the world's going through a lot right now. How can you be helpful and kind of meet them there? And what solutions do we have in place for that. But I always look at the disease of addiction as if, for me personally, this is not what I teach people to say. This is not anything, but from my personal view is I look at it, like cancer. And if my little boy or my daughter had cancer and they needed care and I needed to access it, there's nothing I wouldn't do. Legal or illegal to make that happen, full Denzel Washington mode. So, I really, but also, I respect where people really are. So, I think acknowledging that, yeah, there is this whole other thing pulling at you right now, and that's big too. And you've got this other thing. What can we do to help you? I think that's the only way you're going to reach somebody right now. You can't tell them it's not true.
I agree with that wholeheartedly. I don't think drawing hard lines and saying, well, we'll need this for them to complete treatment. I think it's working with families, seeing where they're at, meeting them where they're at, and just really just showing a lot of empathy towards them right now because we're all in this together. And I think that if you can just echo that to them, talk it out with them and see where they're really at and see, we all, we have a private pay rate that we use, but, in these type of times, it might not be it might not be an idea to give people a little bit of a break with people and try to help them out right now. And I think, back to just the human element of this, people are terrified. People are really scared. And so my conversations I'm having and when I'm telling my reps is just, let's see where they're at. Let's get a baseline of where they're at. Is this someone who's trying to beat me up on the price because they're trying to get a good deal right now? Or is this someone who's really struggling and they're terrified that their loved one is going to die from heroin addiction or alcohol addiction or whatever they're going through, and just really meet them where they're at and try to do your best to help them.
Yeah, the only other thing I'd add to it is make sure you're educating yourself about what these fears really are. I think it's very viscerally easy to be afraid when you see the stock market do what it did and you see unemployment numbers to be what they are. But over the last couple of weeks, I've been privileged to read a lot of things coming out of Goldman Sachs and coming out of some chief economists, and they're not comparing this to '08. And I think that's what everyone's giant fear is this is an '08 level event that's a long and persistent burn. Most of them are comparing it to a 9/11, which if y'all remember way back then, it was really scary and really kind of up in the air there for a short while, but we bounced back pretty quickly. So a lot of people are seeing this V curve of where our economy is to be back within 11 to 18 months. And knowing this, and I think will help you navigate how your program takes people in. Like Doug said, how flexible can you be? What can you do? And also be a little more comfortable when you're working with them, letting them know it is going to be okay. I mean, if you think about it, those 6 million unemployed, a lot of those are going to go back to work once Disney opens, restaurants open, things like that come back to work. There's going to be a lot of people right back to work within a matter of a month or two. So I'd say keep it all in perspective. And like Jamie said, this is a life-saving issue, so make sure you put that first.
Nice. Okay. So Jamie, you have, in addition to business development, you've had a lot of success in helping companies find their overarching marketing strategy. Can you talk about the importance of designing marketing materials and having a company's website echo the voice that their reps in the field are trying to convey to referral sources?
Absolutely. And I'll correct you a little bit there. I've had a lot of success building good teams. And so I've had the luxury of having some really good people on my teams, but I'm no web expert. I'm not really an expert in anything. I'm just unrelenting on getting the right people. So it's been them, and a lot of them are on this call. So I think that, definitely right now especially is going to teach a lesson. And that lesson is, I'm a country guy. I grew up in Kentucky. My grandmother, used to say, don't put your eggs in one basket. Well, that's going to be apparent now more than ever. So I think multi-channel marketing is important. What are you going to do if one dries up or whatever? And then, the message, when people start talking about brand, in about 3 minutes, you're going to get ripped off for a bunch of money. It's like can be it's a very ethereal thing. But what I will tell you is that communication is everything. And so having marketing materials that are informative, to the point, and say what they need to say, but not what they don't, is very important. Having websites that are designed for conversion, for substance abuse. So the number one offender that I see is that, Johnny hires so-and-so web company. So-and-so web company drives traffic like crazy. Traffic, and I say, okay, let me see your top blogs that people are clicking on. Well, energy saving gummy bears, how to get high off of Lysol. I'm making stuff up, of course, but so that's not convertible content. So one key thing I learned from a mentor of mine is that you got to take time to work on your business, not just in your business. And so now's a great time to work on those things, really get your messaging tight, do some trainings. I did an organizational kind of strategy and overall kind of company culture, workshop the other day with a company, because they are going to utilize this downtime, because they know that being a cohesive team is the most important thing, so really focusing on those things. And now's a good time. I'm been doing a lot of writing lately with folks, and really tightening up their message. And it's hugely important. And especially, one sales channel should complement the other. It shouldn't be that they're siloed. So digital marketing, your BD team should love your digital assets. If they don't, you've got a problem. Your admissions team should love your digital assets. If they're always complaining that, what's on the website isn't what's in treatment and we're having to deal with that, well, you got a problem. So, again, that multidisciplinary approach. And, I read again for the many times the other day that, if you don't weigh in, you can't buy in. So I think now is a good time to have your whole team kind of look at your marketing efforts and saying, is this what we really want to be doing right now? In regards to, is this communicate who we are? But I don't think people should do less marketing right now. I think they should do more. Did that answer it?
Nailed it. Here is.
Well, I got to go, guys. Been a pleasure. Thank you so much. Everybody out there, all my peeps, love you. It is a scary time, and you will be in my thoughts and my meditations. Have a great rest of your day.
Take it easy, Jamie.
Okay, so here's another one. This is I don't know who this was, but question here. There are many news stories on why liquor stores remain open. I've seen several answers to that question, and one reply has been that people end up in ER and severe withdrawal. Do you think that weighs in on the decision to keep the liquor stores open right now?
Not a bit.
Yeah.
I think it's all tax money, honestly. If they lose liquor taxes, that is a ton of money out of the government. So I would love to be altruistic and think that absolutely they want us to make sure people don't go on withdrawal, but no, it's all about tax revenue in my opinion. And what we're even seeing from like Pennsylvania is people are just driving across the border, Ohio or Delaware or Jersey, and they're buying their booze there and driving back. We got to remember, like 1 out of every 10 counties in America is still dry. So this is something that people have overcome in America for a long time.
Yeah, I agree with that. And I also think that, you start taking the liquor away and stuff, you're going to see even more stress than, we could possibly see just from an economic downturn. But this kind of goes to my point that I've been saying, is that I think that, liquor sales are through the roof. Guns are sold out in the city of San Diego right now. You cannot purchase a gun in San Diego because there is none in stock. And what this all tells me is that, right now we're in a really time in our like I talked to Steve about, I've talked to Jordan about, talked to John is like we're heading, I think, to a place where our industry is going to be one of the most vital resources in America in the back half of 2020 and the first half of 2021. So all these fears and everything we're feeling, I mean, they're very rational and they're very real, but I also feel like we've got people at home right now that are abusing alcohol. We've got people who are abusing drugs at a much, much higher rate. If you think of the disease of addiction, its primary objective is to get you alone so that you can be isolated and you can, really, use the drugs and alcohol that kind of soothes your mind. And right now we're creating a perfect storm inside of America where that is what is being promoted, that is what's being pushed on us, and it is actually the safest course for us to get through COVID-19, but it's also a fast track to, wherever your addiction was, it just got springboarded, I think, in at least 40% of the families at home. And so when you're seeing stuff like that, I mean, I think we have to brace for a huge uptake in intakes, a huge uptake in people needing treatment. And I think, like Jamie said, I think marketing and becoming more visible is going to be crucial in the back half of this year and the first half of next year, because there's going to be a lot of people needing help. I mean, I read a report, I don't even have the numbers, but suicide rates are up during that. I mean, people are lonely. People are suffering inside their homes with mental health problems. And, I know I'm way off track by if why we're still open, but that has something to do in the fact that I really believe there'd be social unrest if you took away liquor today. I really believe that. You look at periods of America, it was during Prohibition, and, it's not for nothing. So I'll add that as well.
And so just for a point of order, we have a few questions left. If you have any more, get the questions in. We'll try to get through them. We can run a little long if that's good with Jordan and Doug. So if you have anything else, let's get it in and we'll see if we can answer those for you.
Yeah. And to your point, Doug and Steve, I know that a dozen years ago, if they would have cut off liquor sales, I would have flipped out, especially being locked at home like that. So here's one that both Tim and Cody kind of hit on. It's in regards to financing options. So they asked, the federal government is providing money in many areas. Banks are holding off loan payments. Is there a chance rehabs could excuse or at least provide some relief for families that want extended treatment, maybe push out repayment for 6 months?
We haven't read anything in the bill that would state it was legislated, and that's probably the best answer I can give right now. My side. I don't know if Doug has any thoughts on it.
Yeah, I kind of agree with you. And then I also have to wonder where the ethical boundaries lie in that. If I'm, telling people like, hey, I'm forgoing payments for 6 months if you come to my treatment center. I mean, it's something we wouldn't be willing to do at this very moment. And really, it would be just around like the ethical boundaries as far as like all the new laws that have been instated that anything that's seen as enticement is, pretty bad. And so it would be something that I would have to have a lot more clarity on before I could give a real concrete answer on it.
So Doug, here's one for you.
All right.
So a lot of companies, I know a lot of the companies that I work with are looking for people with experience that come in with their book of business. You have had a lot of success with bringing in reps, training them up and developing them who really had no prior experience in this industry. What are some of the traits that you look for in people that have either gone through your program or people that that you feel like make them good candidates to excel in business development?
I think the first thing I look for is I want to see that they're competitive. I want to see that they hate losing. And this goes back to kind of the whole Nigel Green thing, that you don't want someone who expects to win. You want someone that hates losing. So that's the first thing I look for. I want someone who hates losing. Second thing is I want a person who's empathetic to the disease of addiction. I don't ever want to get a phone call talking about, they're tired of working with junkies. They can't deal with this, because I've heard about these horror stories in this field, right? And I don't want to deal with that. So I want someone who's empathetic to the disease of addiction. The third thing is I really want them to really carry themselves like they're always representing my company, I feel like if someone has those three things, I can teach them all the technical stuff to make them a great rep, but those are intangibles. Like if you have someone who is just, has a big heart and has a real to help people, I can turn that person into a good rep, as long as they all person and hates to lose. Because I know it's a taboo thing to say that we are in sales in this industry, but we are, and it's not, it's not pretty to say it like that, but it's the truth. So I want someone who's competitive. I want someone that every time they're on the conference floor, they want to meet the best people in that room. They want to be always making the right meetings, and they want to always be in the forefront of everyone's mind. And so, the first thing I look for are they a competitive person? And then, the second thing is I got to know that they're empathetic and that they truly, to their core, want to help people. Like I want the guys who, if they weren't in this field, they'd be on an H&I panel helping people for free. Those are the guys I'm looking for. And I think I've been able to do that. Obviously, a lot of people have hired my reps. I'm like the Oakland here. It's like people come and pick up my reps. So, and I love it. And that's the other thing. I truly have to love watching my guys go further and like accomplish more, And so the flip side of that, doing this, I have to be willing to pour my soul into these guys, knowing that more than likely they're going to go take a better job, and I get to watch them flourish somewhere else. So that's kind of my standpoint on that.
Okay, so here's one more new question. My treatment center is seeing an uptick in new admissions, but those people who are coming in are relapsed clients. We haven't seen many referred clients. Are you seeing that at your centers as well?
I can't say we have, but I haven't looked at the data enough to give a very clear answer. It doesn't feel any different than 4 weeks ago, so I'm probably don't have a good answer for that one.
Yeah, I'm seeing that as much. I think that a lot of people are going to get. But for us, last week we had a big surge of AMAs whenever they announced that they were going to extend the lockdown. We had about 5 AMAs just right off the rip. So, and one of our strategies has been to make sure we're staying in contact with alumni and recent AMAs as much as possible, just because guys are making choices here, and, with addicts and alcoholics, so that's usually not a good headspace for them to be in. So I could see that being a trend, but I'm not necessarily seeing it.
I think we will in about 3 to 4 weeks.
Yes, whoever asked that question just might be on the early end of things. Yeah. They actually be a little ahead of the curve on it, because that is something, if I'm just forecasting, I see that being where most of the referrals come from, because I can't imagine that I'm the only one that had to deal with AMAs whenever the shelter in place came and we went to telemed. So I would imagine that a lot of those people made impulse decisions, went back home to wherever that may be, and now they're wondering, like, why would I have done that? So I think that forecasting, we're going to see a little bit more of that.
Great.
All right, so we want to take this one last one.
Have a last one?
Last one, we're going to end on a easier one, I guess. The suggestions for a subject line when reaching out in an email. Looking to connect, find out what they may need. Things mentioned here. I'm going to assume it's a blind email, so they don't have any relationship with you to date. I don't know. I think there's a lot of opinions on strong emails. I'm pretty vanilla when it comes to that. I always say looking to connect, introductions, Steve and I, Lakeview Health, something like that. That's typically the way I've been. I don't think I really have any magic around that other than clarity of what I'm looking to accomplish. And those are typically the ones I open in my emails as well. So I don't think there's any magic trick to that unless we have a better marketer than I on here. Which there's probably a lot of people here. There's probably a lot better than I.
Yeah, I would refer to Jordan on that because I'm the worst at sending emails. I don't even think I pay attention to the subject line. I'm always a big believer in phone call. Goes phone call, text, handwritten letter, then email. So Jordan would probably be good at this. He's thrown a couple conferences in his time.
Yeah, it's just, something that's going to grab their attention, looking to connect, trying to establish a relationship. If you have a good name and reputation, throw your name out there. If you're referred by someone who has a good name and reputation, throw that in the subject line. But, don't write a whole paragraph in the subject.
Yeah.
All right. Well, want to thank everyone for coming out today. We have, looks like most of the people still on who signed in. Thank you guys so much. I'm humbled that you took an hour to listen to the four of us yammer on about BD stuff during a virus, but hopefully you got something awesome from it, and hopefully you're able to gain from it. If you're looking for contact info for any one of the four of us, you can still use that events@lakeviewhealth.com, or if you want to go directly to me, it's sdonai@lakeviewhealth.com, and I can get you anyone else's emails on this as well. Or if you guys want, we can also type our stuff there in the chat box before we sign out, so that could also be another easy peasy way of doing it.
Throw mine on there. Steve, thank you for putting this on. This is really well done. Really grateful to be a part of this. Thank you.
Steve, since this is being recorded now, will we have the visual, the audio and visual available through your YouTube channel?
Yeah, we'll see how we're going to put this out here. Stay tuned. I hope my marketing team got everyone's contact info, and if we do have that, we'll get the hard email out to you with the video.
Perfect. Thank you again,
Thank you all.
Steve. Yep,
Social
thank you.
distance.
Yeah, wash your hands. Purell. It's really good.